Hello, I'm Christiana. I'm a postdoctoral fellow in Dr. Isabella Barrow's lab at Sunnybrook Research Institute. Today I will be discussing delivery of a selective TrkA agonist to the brain using focused ultrasound to enhance cholinergic function and rescue cognition in a mouse model of Alzheimer's disease. Alzheimer's disease, or AD, is characterized by widespread synaptic and neuronal loss that contributes to cognitive impairment of affected patients. A cardinal feature of the disease is severe degeneration of cholinergic neurons in a region called the basal forebrain. These neurons, through the release of the neurotransmitter acetylcholine to the hippocampus and cortex, play a key role in cognition. And the overall cholinergic degeneration that occurs in AD is illustrated here. Mechanistically, a loss of trophic support through nerve growth factor, or NGF, and in particular, reduced signaling through the NGF receptor TrkA relative to the other NGF receptor P75 plays a key role in AD-related cholinergic degeneration. Yet challenges for clinical translation of NGF exist, including the inability to cross the blood-brain barrier, or BBB. In addition to TrkA binding, native NGF also binds to P75, which is associated with downstream degenerative signaling in these neurons. And so to address these limitations, we tested a selective TrkA agonist called D3. However, like NGF, it does not cross the BBB, so we coupled D3 with MRI-guided focused ultrasound, or FUS, in combination with intravenously injected microbubbles to locally and transiently increase BBB permeability. And this is with the intention of non-invasive drug delivery to the basal forebrain. To address some of the fundamental limitations of NGF-based therapies, we sought to investigate the effects of non-invasive TrkA activation via FUS-mediated delivery of D3 in the presence of AD pathology. Here I will present the results related to the feasibility and therapeutic efficacy of D3 FUS treatment in a transgenic mouse model of AD, which exhibits cholinergic deficits and thereby represents a disease-relevant model to test NGF-based therapies. First, D3 was administered intravenously and FUS was targeted bilaterally to the basal forebrain. Control animals received either intravenous saline, intravenous D3, or FUS alone. Histologically, BBB opening was confirmed in the basal forebrain by increased Evans blue dye extravasation, as shown in red, relative to animals treated with Evans blue alone. D3 FUS treatment led to increased TrkA activation, as measured by receptor phosphorylation, as well as activation of downstream signaling cascades, including AKT, MAP kinase, and CREB, in both non-transgenic and transgenic mice. D3 FUS also enhanced cholinergic function, including CHAT activity, the enzyme that synthesizes acetylcholine in both non-transgenic and transgenic mice, shown in blue, relative to D3 treated controls, shown in red. D3 FUS also increased acetylcholine release in the projection regions of the hippocampus and cortex in both non-TG and TG mice in both regions. Finally, in a repeated treatment paradigm, we probed for cognitive function. There was a robust genotype deficit in the AD mouse model across various behavioral tasks, which was only rescued after D3 FUS compared to D3 or FUS alone. Animals were first tested in the Y maze to evaluate spatial working memory. The Y maze consists of 3 equal arms and is based on the natural rodent preference to visit a less recently visited arm. Recognition memory was assessed in the novel object recognition task, where the mouse is presented with 2 identical objects. Then, following a delay, one of the identical objects is replaced by a novel one. The Barnes maze was used to evaluate spatial learning and memory, where mice use visual cues on the wall to find the location of an escape box underneath a circular platform. This escape box is subsequently positioned opposite to its initial location to evaluate cognitive flexibility. And so taken as a whole, the results of this behavioral battery suggest that D3 FUS treatment improves cognition in the presence of AD-related cholinergic deficits. Overall, this work highlights the feasibility and therapeutic efficacy of selective TrkA activation combined with FUS to enhance cholinergic tone and rescue cognition in the presence of AD pathology, and thereby represents a promising neuroprotective strategy for AD. Finally, I would like to acknowledge the following individuals, research collaborators, and funding sources for their support. Thank you.